Welcome back to my channel. If you have interstitial cystitis or painful bladder syndrome, this video is for you. I'm going to guide you through 4 gentle exercises to help decreasing your pain associated with your painful bladder syndrome. I'm Dr. Alex Hill, your physical therapist for everything pelvic health. Make sure that you subscribe to my channel so you don't miss any new content on pelvic health and managing your pelvic pain. Because people with painful bladder syndrome often experience pain at the bladder and the pelvis and the pelvic floor muscles, the stretches that we're going to be doing today are going to be opening up these areas and improving the mobility and the muscle tension of the abdomen and of the pelvic floor. Always check with a medical provider first before starting any new exercises. If you have any increase in pain with the exercises in this routine, if something doesn't feel right, stop the exercise. I'm going to show a beginner version and a more advanced version for each of the stretches, so just choose what feels right for you. For the first exercise, you're going to take 2 pillows and then fold them in half. You're going to put 1 pillow under each knee. Once you've got them under your knees, you're going to lie down and make sure that they're in a comfortable position that you can let your legs relax completely. Another option is to use a wedge pillow that you'll place underneath your legs, scoot your bottom up towards the base of it, and then lie down. Once you're in a comfortable position, place your hands on your stomach or on your stomach and your chest, and you're going to take some deep diaphragmatic breaths. As you breathe in through the nose, you should breathe into your ribs and into your abdomen, as well as into the pelvic floor. That means that as you inhale, you should feel your abdomen rise to the ceiling and your pelvic floor lengthen and almost bulge out like you're about to pass gas. As you exhale, you'll exhale through the mouth and let everything return back to its starting position. So breathe in through the nose, fill up the abdomen and pelvic floor, and then exhale and let everything relax. You can do this breathing for a minute or 2, whatever feels most comfortable for you. The goal of this breathing is to relax the nervous system and relax the pelvic floor. What's great about this exercise is you can even do this diaphragmatic breathing and dropping the pelvic floor in different positions like sitting up or standing whenever you start to feel your pelvic floor be tense and have pain. The second exercise is going to be trunk rotations. Starting on your back with your arms out to the side and your knees bent, you're going to gently and slowly turn your head to one direction and drop your knees to the opposite side. Once you come back up to the starting position, you're going to drop your knees to the other side, head goes opposite the knees. A tip for doing this exercise to really get the most out of it is to do the movements with your breath. So you're going to breathe in on the way up, breathe out on the way down. If you're having a bad pain flare day, then you can do this exercise in a small range first, and then as the pain starts to decrease, you start to feel better, then you can start to increase the range and go all the way down to the floor or whatever feels most comfortable for you. You can do this exercise in sets of 10, and you can do it once or twice a day or whatever feels best for you to help manage your symptoms. The third exercise is happy baby. So you're still going to lie on your back, but you're going to bring your knees up towards your chest and then let them relax out to the sides. Your hands should be supporting at the knee or at the thigh, whatever feels most comfortable for you. If you feel like you need a deeper stretch, you can bring your knees up even higher and hold your legs at the lower calf up towards your ankles. Whatever position you choose to be in, make sure that you're doing that deep diaphragmatic breathing and relaxing the pelvic floor that we did in the first exercise. The goal of this particular stretch is to help lengthen and open the pelvic floor muscles and help them relax. Again, with painful bladder syndrome, the pelvic floor muscles are often tight and overactive, so this is used to help relax them. You can hold this stretch for a minute, and you can also bring your legs up and down to whatever feels comfortable for you if your hips or your groin starts to get a little uncomfortable. An alternative to using your hands would be to use pillows folded up, and you can use those on either side to help support your legs. The last exercise is cat-cow. So you're going to start on your hands and knees. Make sure your knees are right below your hips and your wrists are right below your shoulders. Breathe in as you look up and arch your back, and then breathe out as you round your back and look down. Make sure you do this movement in a slow, controlled manner and coordinate it with your breath. So again, breathe in as you look up and arch your back, and then exhale, breathe out as you look down and round your back. You should not have pain with this. So if you do have a day that you're having a little bit more pain, then you can do it in a smaller range, just like the other exercises. So doing a small arch and a small round of the back. And as you start to feel better, that pain is starting to decrease and you're moving better, then you can start to really increase that range to what feels good for you. You can do this exercise in sets of 10. You can do it once or twice a day or whatever feels good for you to do. And what's great about this exercise is you can also do this exercise sitting down on a chair. You'll just round your back, folding forward, and then sitting up nice and tall, extending backwards to get that arch. I hope that you got some relief from these exercises. Please like this video if you found it helpful and subscribe to my channel for more videos on pelvic health.